and you already mentioned this briefly, but you mentioned cancer is probably the least well understood as far as what we can do to prevent it. But you also mentioned that exercise is perhaps the greatest longevity drug. So do we have evidence at this time that exercise can help prevent cancer? And that's decoupling exercise from, the benefits it might have on someone's, weight. If taking someone from obese to not obese, I mean, we know that can be helpful for cancer, but just can exercise alone help prevent cancer to our knowledge?
Yeah, I think there's very good evidence that it can, right? When you think about some of the things that exercise is doing. So if you think about the metabolic benefits of exercise, it certainly far transcends weight loss. Muscle is by far the most important sink for glucose. And so insulin sensitive muscles are equivalent to insulin sensitive people. You can't be insulin sensitive without having insulin sensitive muscles. You can't have insulin sensitive muscles without exercising once you reach a certain age. I mean, a youngster maybe, but certainly by the time you're in your 20s and 30s, you have to be exercising to maintain true insulin sensitivity. And that may be the single most important factor there is. But going beyond that, exercise does a lot of things, right? It creates a lot of myokines, a lot of chemical signals that do various things throughout the body, including reducing chronic inflammation. And I think chronic inflammation is one of the impediments of the immune system. And so if being insulin sensitive cuts down on the growth factors, having less inflammation enhances the immune system. And you could certainly make the case, and I would make the case, that those are probably two of the most important things at our disposal when it comes to reducing our risk of cancer.
Excellent. Any other cancer prevention strategies besides the ones that you've already highlighted that one should consider? Of course, avoiding detrimental things like smoking aside.
Yeah, I think those are really the big ones. I mean, there's things we don't understand. We probably don't understand exactly the role that stress is playing on cancer, but I just have to think that there is a legitimate risk there through the mediation of hypercortisolemia and excessive glucocorticoids on the immune system as well. So I think, just some level of immune system and immune cell exhaustion as we age is probably equally responsible for the exponential increase in cancer as we age, right? I mean, part of that I think is more time to accumulate mutations, and mutations are the core thing that are driving cancer. But I also think at least half of the equation is that our immune system is getting weaker as we age. And that's actually one of the things where, if I think about all of the sci-fi things that are going on out there, the one that I would most want to see come to fruition would be addressing the exhaustion of the immune system. So if we could sort of manipulate the epigenome of T cells specifically and turn old T cells into younger T cells again, that would have a profound impact, I believe, on cancer treatment.
Any other cancer screening modalities that we missed? We talked about lung, colon, breast, prostate. You mentioned screening for cervical cancer briefly, skin checks. You mentioned any other ones that we're missing that we have the opportunity to screen for?
Yeah, I mean, there certainly are, and it's always going to be case by case, right? So, for example, in a person with a history or a family history of bladder cancer, or in someone who has a personal history of smoking, we would even recommend cystoscopy. For people who are former smokers, we also add low-dose CT scan to the lung MRI. The MRI of the lung is, with diffusion-weighted imaging, is equal probably to the low-dose CT for adenocarcinoma. But when you're talking about small cell carcinoma, squamous cell carcinoma, or large cell, which are more common in smokers, I think you're getting more benefit from the low-dose CT scan. So we're doing a low-dose CT of the chest annually in former smokers as well.
And then what about just genetic testing for your patients, getting their whole genome sequenced with something like 23andMe or one of those companies?
I mean, I think every one of these things has its place, but you have to know what you're kind of looking for before you do it. I mean, again, if a person's been adopted, then I think there might be some benefit in doing it. You might come up with something that you really didn't know. But, you'd be amazed what a very thorough family history can accomplish for a person. And at least when it comes to cancer, I think we probably get more insight genetic testing on some of the other diseases, but with cancer at this point in time, we generally don't routinely screen, and we use the screening selectively based on an individual's history.
Okay, well, to finish up, any other final thoughts on cancer screening or prevention?
No, I think unfortunately, prevention and screening have to be our main strategies today. I think the treatment landscape is, still kind of lacking relative to cardiovascular disease, though it's further ahead than neurodegenerative disease. But personally, I remain incredibly optimistic about what's going to come as far as, expanding the capacity of immunotherapy. Again, I said something earlier that might have gone over some people's heads because I just sort of mentioned it in passing, but we now know that 80% of solid organ tumors have novel neoantigens, meaning 80% of the cancers that people think about when they think about getting cancers that kill have enough antigen that a person's own immune system can recognize it. The problem is not enough of the immune cell can recognize it, and that's why ultimately the cancer wins. So we're playing a game of tug and war right now, and the good news is we at least have some guys that can hold on to the rope. The problem is we don't have enough in most cases. So we have to figure out a way to increase the number of cells, the number of T cells that can expand to meet that need once they recognize a cancer cell. Because I do believe that ultimately there is no therapy that's going to rival that of immunotherapy.
Well, Dr. Attia, thanks so much for your time today. Thanks for your fantastic book. I really enjoyed reading that, and it's you systematically go through many of the things that we talked about today. So really appreciate all the time you spent on that.